Welcome back. Now, whether you suffer from body pain or limited mobility, our next guest is an expert at making you feel better. Welcome to the show, interventional pain specialist, Dr. Efrain Cubillo. Doctor, thanks so much for joining us today.
Thank you for having me.
Pleasure. And you have a really, extremely successful past in education as well. Give us a rundown of where you've studied.
So I did my anesthesiology training at the Mayo Clinic, and also I went to Harvard for an interventional pain fellowship.
Impressive. So anybody who deals with you knows they're dealing with an absolute expert. He really knows his stuff. And let's talk about what a pain specialist does exactly, if someone's wondering.
So that's a great question. Basically, pain doctors, we treat pain from head to toe, whether it be migraine headaches to neck pain, down to the thoracic pain and lumbar pain in the lower back. In addition to that, we also treat hip pain from osteoarthritis, in addition to knee pain as well. Also, we treat patients after surgery that continue to have lower back pain and neck pain, in addition to feet pain, so from peripheral neuropathy, from other conditions like diabetes as well. So we treat the whole patient from head to toe. We perform thorough histories, physical examinations, and we decide what imaging modalities that we need, and we basically formulate this multidisciplinary plan to say, well, do we need medications, physical therapy, acupuncture, injections, and we sort of formulate this plan to treat the patient.
All of that to say it's a complete solution to
Absolutely.
deal with your pain, and we all deal with it really at all levels of ages and all levels of health, and so it's very important to have pros that deal with that specifically. And today we're highlighting osteoporosis, and people might have heard of it, they might even have it, but for folks who don't know what that is, what exactly is osteoporosis?
So osteoporosis, in simplest terms, is low bone mass. So what it is that there's a demineralization of bone. So in this model here, this is simply normal bone. The bone is full on the inside. We call that trabecular bone, and on the outside is cortical bone. In an osteoporotic patient, the inner part here is somewhat collapsed. There's demineralization of bone, and there's different types of osteoporosis. Type 1 is mostly postmenopausal women. Estrogen is there to support bone mass, and type 2 is just age-related. The outside and the inside actually does reduce.
Right.
Patients, we can get a bone density scan to identify their T-score. If it's less than -2.5, what happens is that is a diagnosis of osteoporosis.
Got it. And I mean, just looking at those two models, there's a clear difference between the two, and of course, you're at risk of certain things when you have osteoporosis. What is someone at risk of?
So the biggest risk are fractures. We call these fragility fractures because patients can do very limited things that cause a lot of pressure on these areas that can result in a fracture. Those fractures are wrist fractures, they are hip fractures, they're shoulder fractures, in addition to vertebral compression fractures into the spine.
Well, and you've brought a model of a spine here, and you mentioned the vertebral fracture. So give us a view of it and what a vertebral body is.
So a vertebral body is a segment, I'm just going to depict at the lumbar spine here, because they're everywhere throughout the spine. It's a large bony structure that protects the spinal cord, which is present here, but what it is it's present between the discs themselves, and this is an area that patients with osteoporosis are at risk for having compression fractures with a small amount of force.
Right, that weakened bone, it can cause that compression fracture, but luckily there is a way to heal it, or to at least make it better.
Absolutely.
And that's another device that you've brought along with you, and a different set of procedures.
Absolutely. So when patients have a vertebral body fracture, we try the most conservative things possible. We try epidurals if a patient has back pain that comes around and goes down to their leg. We also brace patients. We can do muscle injections. But when patients fail those modalities, we do something called a kyphoplasty. So that's a vertebral augmentation. So what a kyphoplasty is, for example, when a patient has a collapsed vertebral body, what happens is that we say, well, let's attempt to make it back to its normal height by utilizing a specific device that allows me to place a balloon directly within the bone itself, and we do this all under live x-ray in the office. So what happens is that I'm just going to utilize this here, and what it does is it actually, we simply blow this balloon up here. It's a little, and what it does is it slowly moves the bone, slowly moves the bone. And you may see that this is a very small balloon, but when you're dealing with a very small vertebral body, it actually, you can see it move on live x-ray. So what happens is after you create this void, you simply deflate it, okay, and now it goes down here. You remove it, and then what you do is you use a different needle to put it directly cement into the vertebral body itself. It takes about 60 minutes to do. There's a small incision in the back, and patients go home within the next 30 minutes. Patients recover very quickly with these here. So 95 to 99% of patients get about that same relief within the next day.
Incredible.
So they recover very quickly. So we see the patients at a week, a month, 3 and 6 months.
Amazing technology, and like you say, you go through the different steps to make sure that they have the exact right procedure that they need for them.
Absolutely.
And that's what your specialty is making sure that people feel better using the least amount of invasion as possible, basically.
Absolutely.
Right? So I want to thank you so much for all this information. Thank you so much for joining us, and people really have to go and see the Pain Institute of Southern Arizona.
Thank you for having me.
Thank you.
Okay.
Now call the Pain Institute of Southern Arizona today to schedule your appointment. They can be reached at 520-318-6035, and you can visit pisapain.com for more information.